you so much. I really appreciate it.
Appreciate you having me. Thank you.
It's been a crazy day. Just came back from work. Was in the ICU. My first day back on the ICU. Wild shift. It's always it's always problematic. The Last Zebra, I started that as a project that I've always wanted to do. I've always wanted to have a podcast. And during medical school, I wasn't exactly sure what I would want my podcast to be about. During residency and certainly during fellowship, I was in fellowship when I first thought about this. And more importantly, during the COVID pandemic.
The World Health Organization has officially called it COVID-19.
These refrigerated trailers are being used to house the casualties.
This woman apparently being taken against her will by China's newly deployed quarantine squads.
The naval ship Comfort is now docked in New York City's harbor and ready to accept non-coronavirus patients. At least 9 ambulances backed up trying to get patients into the emergency room entrance.
At the same time, we had a lot of time, but in the medical field, we're also very, very busy. So at work, we were very busy, but then when we were off, we were off. I got to thinking about ways that I could help disseminate information or transfer information that I'm learning on the go with my work with regards to the pandemic. Of course, I didn't have a platform to do that with, but that experience also highlighted to me that the people we work with, we often have labels that we attach to them without ever getting to know who they are behind those labels. Nurses, respiratory therapists, doctors, all the healthcare professionals that we interact with, that we form these kind of very intense bonds because of what we experience in the hospital. And we don't actually get to work or establish those bonds beyond the hospital. So I wanted The Last Zebra to be a way, initially at the upfront, a way to have those conversations about who we are, where we're from, and how that impacts our work, how, your parents and where they're from, and how the way you treat your patients kind of manifests itself in all of those things that you've experienced across your life. I think that's what's the most important thing about people in general, is the story behind the titles. The people behind the titles. And that's what The Last Zebra was meant to be and started off as. So my cousin, the very first guest that we had.
Am I a stalker? Have I been stalking you?
No, you literally been stalking me since I was 5 years.
Wow.
He came to visit me and he was just like, let's do it. And so we sat here and, shot that very first episode on a whim.
Anyway, here we are, finally.
Thanks for being my first guest. Welcome.
My brother.
Thank you, sir. Welcome to the podcast.
Thank you, sir.
And just kept it going since then. I feel like now I wanted to take a break. Now that it's becoming a little bit more serious, I wanted to take a break and give it an honest effort, put some real, genuine thought behind it. We've expanded beyond medicine and we talk to people of different walks of life, different backgrounds, different professions, and with the same goal in mind. Who are the people behind the profession? What drives them? What motivates them? And at the same time, talk about some detailed topics about that they're passionate about within their field of expertise. The relaunch is really, or the rebrand is really a renewal of a commitment to this process of diving into being a storyteller, which is something I'm very passionate about, and working on being a good listener and, having meaningful conversations with people I admire and respect and look up to. That's a really good question. In medicine, we have a saying, and I remember when I was in residency, the nurse practitioner that was basically the mother of our program, one of the very first things she would tell us is, when you hear hooves, think horses, not zebras. As a medical student, as a trainee, you're always excited to diagnose that, that rare disease, the thing that stands out, the thing that you've been reading about all along. But in reality, the most common things are common for a reason. I thought the name The Last Zebra would, one, be an homage to Fabian Whitney, that's her name. Rest her soul now, she's passed away. A wonderful human being that left an indelible mark on anyone that she got in contact with, and certainly us as residents and trainees underneath her. She was in a very unique position as a nurse practitioner training residents, medical doctors, medical trainees. So in a way, it's an homage to her and my residency program that I'm very, very proud of, Chabert, Leonard J. Chabert residency in Houma, Louisiana. The other thing is, of course, what it means to be a zebra, which is something rare, but also finding what's common amongst all of us. We tend to narrow people down to very simple things, black and white, if you will. But more often than not, we're very complex people. And on any given day, we can be challenged in a new way that brings out a different side of us. And anyone that interacts with you on the right day or on the wrong day might have a forever impression of you, but that's not really who you are. This is a way of finding that common ground, recognizing that while we are all unique in our very special and individual ways, we're more alike than we are separate. We're more horses than we are zebras, ultimately. And that's what that comes from. There are a lot of physician content creators out there that I think are doing great work. Especially now, I feel like we really need to have voices in the space of content creation that are knowledgeable, are well-researched, and well thought out, with good intentions, of course. And I think there's a lot of, one of the great benefits of modern technology is the ease of access to information. But not all information is good information. I mean, I think that goes without saying. Especially where healthcare, and medicine is concerned, everyone has an opinion, and which is okay, but not everyone has the expertise to be able to think through some of these topics that are being discussed out large and with some kind of responsibility. And I think voices in and around the medical field should be amplified because these are the people that are walking that walk. These are the people seeing the patients. These are the people interacting, reading the papers, doing the research. Whether it's PhDs, MDs, DOs, nurse practitioners, the people that are actually having these kind of experiences that can back the knowledge that they're trying to impart. There's a lot of misinformation around medicine right now, a lot. And sometimes when I'm going through, when I decide to doom scroll and I'm going through TikTok and Instagram, Twitter, and some of the stuff you're seeing, and you're like, this is just not true. And it can come from people that seem credible, but that's the challenge, of course, is especially with artificial intelligence now, so many things can make to look like what they're not really. That applies to words, and that now applies to how people look on screen. So I feel like now is the most important time to be authentic and to lean into speaking evidence-based truth and establishing at least a corner on the internet where people can look to with integrity and trust. And that's really what I'm trying to achieve here as well. At the same time, kind of humanize people in and around medicine and anybody else that we get on the podcast that would have an interesting story to tell. Non-negotiable for me is 100% not trying. something I live by is that the answer is no unless you ask. That drives me. So, and I'm not afraid to fail. In fact, I would make the case that most people that end up being successful anyway have probably also failed the most. The reason you find success is because you keep going. And there's a lot that goes into that. But you also want to find who you are. Like you want to push that envelope of what you can do. And that's what failure is. I think failure, the way I measure failure or missing the mark or not exactly coming up to standard, the way I measure it is that it tells you where you need to improve right then and there. You have the immediate, I didn't have enough today. I'm gonna have enough tomorrow. And then when tomorrow comes, you try something, you try it again and you find a new wall. I didn't have enough tomorrow. I'm gonna have enough the day after that. And that's the way I try to approach things that way. Again, and I agree with you 100%. As long as it's not, obviously I'm not hurting anyone and I'm not doing anything out here that is illegal. I'm willing to, I'm willing to see what I'm about, I'm about that. I want to know what I'm about. I want to know that if I run into something and it knocks me down, the most important thing for me is to know that I can get back up. And that is non-negotiable for me. And really what I'm trying to say is, because whenever I think about questions like this, I'm thinking about my kids, is what I want to be. I want to be the version of man that my kids think I am. Does that make sense? Like they think my son would thinks I can jump over, my son thinks I'm Superman. He'll tell you, oh yeah, daddy can touch that, daddy can reach that. And he's talking about the top of the building. Oh yeah, daddy can reach that. Of course, that's something I can't do, but in his mind, that's the capability that I have. I want to strive for that. I want to strive to be that version for my kids. And I want them to have that same attitude about things, especially when things don't go your way. Life is you're going to get knocked down. It's all nice and dandy when life is good. But really you find out what you're made of when you run into some challenges. But that's really it. I think that is the crux of why we're here. It's to find out who we are and what we're capable of doing. That's non-negotiable for me. I think doctors are storytellers. We get information from our patients, and we formulate a story based off of our training and experience that matches what we feel would be the reality that would then help treat our patients. Storytelling to me is a crucial part of the human experience. For the longest while, storytelling is how we communicated, You think about the parables and the fables and the mythologies and all these things, the lessons of life that have been passed down for generations, for eons and eons. That's all through storytelling. Also, the ability to tap into your imagination, the creativity, the ability to see a world that nobody else has ever seen before. I marvel at people like J.R.R. Tolkien that wrote Lord of the Rings. The man invented a world from his mind. And within that story, there's so many lessons to be learned. And that's just one example. The same thing applies to us when we're as physicians, or providers in the healthcare space. When we're meeting and talking to all these different people on a day-to-day basis, everyone with a unique story. And that story informs you. And you learn lessons from your patients' families, from your patients' experience. I can't tell you how many times what a patient is going through leaves an indelible mark on me and gives you a new perspective or a new focus on life. So stories are an important part of human society. But we need to, I think, especially now that, again, AI is going to be rampant and AI is going to be pervasive in society, authentic stories are going to be so important to be seen and heard and told. And that's what I'm hoping to contribute to.